Good afternoon. I'm Dr. Bonnie Henry, Provincial Health Officer for British Columbia, and this is our COVID-19 report for today, September 24th. I want to start by acknowledging with gratitude that we are on the traditional and unceded territories of the Lekwungen-speaking peoples, particularly the Esquimalt and the Songhees First Nations, and we're very grateful to be on these lands today. For today, we have 148 new cases who have tested positive or who have been diagnosed with COVID-19, including 12 who are epidemiologically linked, bringing our total number of cases in British Columbia to 8,543. This includes 3,094 people in the Vancouver Coastal Health Region, 4,361 people in the Fraser Health Region, 203 people in the Vancouver Island Health Region, 520 people in the Interior Health Region, 278 people in Northern Health, and 87 people who generally reside outside of Canada. We now have 1,371 active cases in British Columbia in all health authorities, of whom 61 people are hospitalized, 20 of whom are in critical care or ICU. There are 3,417 people under active public health monitoring and 6,917 people who are now fully recovered. Tragically, we've had an additional 2 people who have died from COVID-19 in British Columbia, bringing our total to 229 people. And I want to express our condolences for these 2 people who died in the last 24 hours, both of whom were in the Fraser Health Region. But I also want to express our condolences and our thoughts to an elder who died on the weekend. I was asked about this question, about this person's death in the Northern Health Region on Monday, and I've had the opportunity since then to reach out indirectly to the family. And I just want to express our deep, deep condolences, understanding how important the elders are in our communities. This was a woman who was in the Nukasley community in the north, and I want to express today our condolences and our sadness for the passing of all of the people who've died from COVID-19, but in particular, our elders. We have 1 new health care outbreak today at the Banfield Pavilion long-term care facility in Vancouver Coastal Health, and 1 outbreak to declare over, the Opal by Element in the Fraser Health Region. So that leaves us with 14 active outbreaks in their health care system, 9 of which are in long-term care and assisted living, and 5 acute care units. In total, 822 people have been infected in these systems, 487 residents and 335 staff. We have no new community outbreaks, but we do continue to have exposure events, as we know, around the province, and these are reported on each of the health authority websites and on the BC CDC website. We also are reporting, as you know, school exposure events, and I would like to take a moment to speak to how we are keeping parents and families and school communities informed about potential exposures and what we are asking parents to do to help keep their school communities safe. When there is a potential school exposure, that first thing that happens in all of our schools around the province is public health steps in to conduct contact tracing and assess the risk for each individual student, teacher, staff in that community. Schools issue alerts when a school exposure has occurred, and supporting these protocols, the BC CDC website and our health authority websites are also publishing school notifications. Like the health authority reporting, we started broad and we evolved our approach, and we're now reporting on smaller geographic areas, as we have on a periodic basis, because we know that that protects people's privacy, but it gives us more information. Maintaining the privacy of anyone with COVID-19 is very important. It is our responsibility, and we take that very seriously. It is also our obligation, and we will not ever publish individual health information, no matter what the circumstances. But schools reporting and the reporting on the health authorities and the BCCC websites is important. It's important because it provides public information that helps you understand what is happening in our school communities around the province. It allows parents to know where exposures are and have confidence in knowing that if they have not been contacted, their families have not had a risky exposure in a school community. We know that this has been challenging, and it's taken some time for us to develop the process and have it consistent across the province. And we also now have approximately 30 school notifications, exposure events that have happened across the province. And that is not surprising to me. We have over 2,000 schools around the province, and with millions of children going back into the schools in the last few weeks, this is to be expected. We have had no outbreaks in our school system yet, but we are monitoring, and health authorities and public health is there for every single school, and we will continue to be there as we move through this pandemic. Through this pandemic, we have been working to find the balance, and we've talked about this many times, to protect our communities, maintain capacity in our healthcare system, and keep as much as possible in our community open and functioning. How well we are able to do this is in all of our control. This fall and winter is going to bring added challenges, which will make finding our balance that much more difficult. That is why now is the time to get back to our basics with COVID-19 safety precautions. Stepping up our efforts now will allow us to continue to keep the curve low, press it back down, and keep our communities safe and well. We can reduce our personal COVID-19 risks by using our layers of protection every day. A starting point for all of us is to remember that the more people we see, the higher our risk will be. When deciding where to go and who to see, we all need to take a moment to think about two things. We need to consider the risks we're going into. How many people will be there? What is the environment? Is it indoors? Is it outdoors? And we also need to consider the risks that we will be bringing with us when we leave. This will help us determine what is safe for us to do right now, and it may be very dependent on the things that we have done in the recent past. We know that our elders, our seniors, and anybody with underlying health conditions are at considerably higher risk of more severe illness with COVID-19. So if this is the case for you or for someone in your household, taking a step back from social interactions at this time is even more important. I have some practical examples that I thought would be helpful around what we've been talking about. Number one, if you or others in your household participate in sports, maintaining your distance on and off the field is important. And we've had some guidance. We've worked with sports organizations to make sure this can be done safely. But that means keeping your distance from other spectators or parents on the sidelines, if you are one of those. And socializing after the game needs to be avoided right now. But if you are out playing with the same group of people on a periodic basis with those guidance in mind, then it may be safe for you to do that right now. If you're thinking about your household safe six, then you want to pick one or two close friends or other families to spend most of your time with. That may mean that each person in your family has one friend versus six. It may mean that you partner with one or two other families that have children the same age that you can keep and have that agreement and talk to each other about how you will manage the risk and the relationships that you have. If your teenage son has a girlfriend, have a conversation with her family to better understand the circumstances in her family and agree on an approach that works for everyone. There are no hard and fast rules, which was what makes it challenging for all of us. But it is about understanding what the risk profile is for each one of us and our families, as well as understanding who we are going to be connecting with when we go out and the risks we both will be bringing with us and might be bringing home again. For all of us, it's about knowing ourselves and our families and our communities. It's about finding that balance that will keep our communities strong and everyone, whether at school, at work, at home, as safe as we possibly can. We need to protect ourselves, and at the same time, we need to take care. We need to take care of our neighbors, our friends, our loved ones. We need to remember how we did that early on in this, how we learned both to work together while staying apart, connecting socially while physically distancing. And we will get through this pandemic together. As busy as all of us might be, we need now to take a moment to think about how we are making a difference through our actions and make our plans as we head into fall. Because we can all make a difference. And let's, of course, continue to be kind, to be calm, and to be safe. I will also note that we will be giving a written report on the surgery restart, as well as the progress that we've been making in hiring contact tracers and other healthcare professionals, and we'll be attaching that to our statement that will come out after this briefing today. Thank you very much, and I'm happy to take questions.
Thank you, Dr. Henry. As a reminder to everyone on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up only. Please also take yourselves off mute. You will not be audible until I call your name. First question today is from Richard Zussman, Global News.
Dr. Henry, Dr. Daly from Coastal Health was on CKNW this morning, and one of the things she said was that Coastal Health would not be listing exposures unless they think someone they can't contact might have been exposed. This seems to contradict what you have said in the past. So is the understanding that Coastal Health will be posting all exposure events online? Should there be consistency amongst the health authorities? And are you concerned that confidence has been lost in Coastal Health, considering the concerns raised about a lack of communication on these cases?
I think it's somewhat unfortunate that there's been some reporting on some of the details around this. I have full confidence that Vancouver Coastal is doing what we need them to do, and that we are all in alignment about what we are talking about in terms of exposures within a school setting, and that what will be posted on websites as exposure events. And we are aligned on that. There are a number of exposure events being reported now on the Vancouver Coastal website, and that will continue. I think where some of the nuance came in was around, exactly what we were talking about as an exposure event. And for all of our health authorities, the most important thing that we are focusing on is investigating whether somebody was actually infectious, whether when they were in the school environment, and making sure that the families and the school community has the information first. And so that is the focus of all of our health authorities, and we will all be posting all of the exposure events on the website.
Richard, do you have a follow-up?
One of the things I think that confuses people is there are only 2 exposure events in Coastal and many more in Fraser, and the number of cases has been pretty similar in both. So do you think what's being done is enough for parents? And on a separate topic, I've received a number of emails since you spoke at UBCM this week and spoke about the threats that you've received. One 15-year-old found my number online and called me and knew I could ask questions and wanted to ask how you were doing, because I think a lot of people are feeling for you and have noticed you look more tired recently. So I know I'm asking 2 questions here, and I'm hoping you can answer both. Thank you.
Don't say things like that. My mother will be upset. In terms of the school exposures, we'll look if you look on the website, we've had about 31 that are reported there. And we have to recognize that the vast majority of schools in the province are actually in the largest school districts are in Fraser Health Region. And so it's not surprising to me that that's where many of the exposure events, all of them have been relatively low risk, and they've all been managed with public health and schools together. So the types of exposures that are being seen in Vancouver Coastal, where people are being exposed, the clusters that we're seeing are different from what we're seeing in communities in the Fraser Health Region. So it doesn't surprise me at all that there's a difference in the exposure events that are actually happening in schools in those regions. And we also look, there has been no exposure events in schools in Vancouver Island yet. So that's just the way it is. It's around how the virus is being transmitted and where the clusters are occurring. In terms of myself, yes, it's, this was, I do want to start by saying there has been much, much more positive feedback that I've been getting on a daily basis, and I appreciate that, both for myself, for my team who works very hard behind the scenes, and for my public health colleagues across the province. We absolutely thank you, and I do appreciate all of the notes and good wishes and the comments people have sent me. It has been a challenge, and this has started early on in January, where some people, it doesn't surprise me in many ways when people are anxious and afraid. Some people's reaction is to lash out in anger, in frustration, and these were unprecedented times. So I am doing fine, and I have a strong sense of community, my neighbors, my friends, my family to support me. And I really appreciate the support that I get from people in our community here in BC.
Next question is from Shannon Patterson, CTV.
Hi, Dr. Henry. Some frontline RCMP officers with beards have been put on desk duty in BC because the force says there are no masks or PPE that are approved for them, even though other police departments don't have those requirements. Can bearded officers wear the same face coverings as shaven officers? And do you have any concerns about police officers with beards working in the field?
Yeah, so I think what we're talking about is infection prevention and control. And if we're talking about respirators and the need to wear a respirator because you're providing care or assessing somebody who has a respiratory illness like tuberculosis or COVID, and you're doing something like intubating somebody where we know it can be transmitted that way, you cannot get an effective seal if you have facial hair. We know that. It's something that we work with all the time in the healthcare setting. I believe there are very few cases where a police officer would need to wear a respirator. For the most part, they are not involved in resuscitating people, and there are many other types of masks that can be used safely for other types of activities that police officers are involved in. I'm not aware of the exact issues, and certainly nobody's been in touch with my office that I'm aware of around issues with the RCMP, but it is respirators themselves that cannot make a seal, but there are other alternatives that can be worn as well.
Shannon, do you have a follow-up?
Yeah, the Prime Minister indicated last night that it may not be a good idea to gather for Thanksgiving, so that way we could save Christmas, he said. And today, Quebec's health minister said the same kind of thing. So where do you stand on this, and what would you like to see in BC this Thanksgiving?
You know, I think Thanksgiving is an important time for us to remember and give thanks for those who we are closest to. And we've been talking about that quite a bit. There's no reason at all why you can't have Thanksgiving with your household bubble, your contact, your close small number of people. I think it is a challenge, and we would not be recommending either that you have a large family gathering where particularly elders and seniors come from other places and get together with people who have had other types of contacts. So, you know, the large family gatherings, we've been saying that through the summer as well. This is not the year for that. This is a year to participate remotely with your family, the people you're closest to make sure that you can find ways to engage in these important celebrations together without putting anybody at risk.
Was that her follow-up? Shannon, do you have a follow-up? Did you already get her follow-up? Next question's from Tina Lovegreen, CBC.
Another one?
My fault. Tina?
Hello, Dr. Henry. Thanks so much for taking the time. My question's about the COVID Alert app. Yesterday, the Prime Minister urged all Canadians to download it. You've expressed support for it in the past, but it's still not available here in BC. So I was just wondering, any idea on when it will come into place? Is there anything specific preventing us from adopting it as an extra measure here in BC, and when those codes will be issued?
Yeah, it is an ongoing discussion. The team with the federal government is working with individual provinces at the same sequentially. So we are on that list, but we are also working with them to make some adjustments that will meet our needs. Some of which they're working out with right now with Newfoundland and Labrador, who is the next on the list. There's some adjustments they made for Ontario that are helpful for us. I'm not exactly sure when, but I know we are on the to-do list for some time in the coming weeks.
Tina,
and I will say with the caveat that as long as it can meet the needs that we have to supplement what we are doing in our contact tracing here.
Tina, do you have a follow-up?
Yes, please. Dr. Henry, what can you tell us about an alleged COVID-19 outbreak on a Vancouver television set? We're hearing as many as 17 people have tested positive. And also my understanding is that they have their own private teams to do testing. Just wondering if there's any insight into that.
I am not aware of that, not aware of an outbreak on any of our sets. I know there has been private testing being done, but I haven't been informed of that.
Next question is from Graham Wood, Glacier Media.
Well, hi, Dr. Henry. On the Vancouver Coastal Health website, it says you may need to self-isolate if a child in your household tests positive for the virus. Under what circumstance would I not need to self-isolate for 14 days if my kid has COVID?
It depends a little bit about the age of your child, where they were exposed, where the exposure event was, and what interaction you have had with the child since they were in their infectious period. So most parents, of course, will be close contacts with a child. Many parents may have had contact with the same person or the same exposure event as the child, and if you are past your infectious period, you would no longer need to self-isolate. So it is a little bit of a depending on the situation, depending on the age, depending on who's been exposed to whom. But for a young child in particular, it's very likely that at least one of the parents will have had a close contact and will need to be isolated as well.
Graham, do you have a follow-up?
Sure. In Denmark, they do testing for any close contact. They do two tests. Here we don't do any tests. We put people in self-isolation for 14 days. But in other jurisdictions, particularly in Europe, you can get testing done and clear yourself. On Tuesday, you talked about how that may not necessarily put you in the all clear, but is there not a sort of way that you weigh testing and letting people get back into the economy and their households versus not testing?
Yeah, so it is a challenging thing because we know the incubation period. So after I've been exposed, it can be up to 14 days to develop symptoms. We know that most people develop symptoms around day 5 to day 7, but some people, and a proportion of them, are highly infectious to others up to day 14. So that is our period that we use for safety, for isolating people. And I know some people are experimenting now. We have not yet seen the results of how people are doing that, and it's a matter of managing the risk. So yes, some countries have said that we'll test somebody at day 10, and if they're negative, they can skip the last 4 days of the incubation period. We have not gone that way yet for a variety of reasons. We still are at the phase where it's important for us to try and reduce the risk of transmission from every single case. So those are things that we are looking at, both nationally and looking at what's happening around the world to see if there's ways of using testing to help facilitate. But you always run the risk then of somebody developing symptoms and being infectious to others in that last part of the incubation period.
Lee Wilson, APTN.
Hello, Dr. Henry. A coalition of 20-plus First Nations are calling for more transparency on COVID-19 from the province. They're asking for proximate case information in relation to their communities. Does the province have a response to that?
Well, I don't speak for the province, but I will say that we have been meeting regularly with the Coastal First Nations around these very legitimate concerns that they have, and absolutely acknowledge that they are doing their best and what they believe is important to protect their communities. And we know that they know best how to protect their communities. I will also say that we have that in common, that both of us want to do everything we can to ensure that First Nations communities in BC are protected as best they possibly can, and we are working together with them to ensure that they have the information that they need to do that.
Do you have a follow-up, Lee?
And the next one they talked about community-led contact tracing. They wanted to have basically somebody from the community assist with the contact tracing. Is that something that's possible?
Absolutely, and I think that's a really important measure to help us work together. And we know that sometimes, and we've seen this in a number of community outbreaks over the past few months in different areas of the province, that when our Western public health ideas connect with communities that are dealing with COVID-19, that sometimes we can have challenges in working together. And this is a really important piece where we can work with community members who are trained and who have some understanding of how to best do culturally safe contact tracing, and can work as a partner with us in helping the community manage outbreaks and cases when they happen in communities. So this is something we're very strongly supportive of, and we're working together with nations to make that happen even as we speak.
Next question is from April Lawrence, Check News.
Oh, hi, thank you. It's a bit of a follow-up to the Thanksgiving question. Here in Island Health, there seems to be a growing sentiment that another day of no new cases, only 8 active cases as of yesterday, that there isn't a need for people here to restrict their social interactions any further or avoid those larger family gatherings at Thanksgiving. What is your response to that, and how do you counteract the feeling that there isn't a second wave happening here on the island?
Yeah, I know we feel a little insular in our island here, but it is a large island, and I think I need to remind people that this virus travels with us, and we move. And when we move, we bring that risk with us of the people we've been in contact with, the places we've been. And we've seen that, and we've managed outbreaks on this island very well, and we have great systems for detecting. We've had some challenges with our testing protocols, or at least Island Health has, but we're working through those as well. So this is not a time to be complacent. We know that if we are complacent and we let our guard down, that this virus will find a way to spread, and it will spread to people that we care most about, that we're closest to. So we need to take that into account. We need to remember, as we're going into cough and cold and flu season, that there's going to be a lot more illness around, and it's going to be very challenging for us to figure out what is COVID, what is influenza, what's just a cold. So now's our time to start regrouping and pulling back and doing the things that led us to be in this position in Vancouver Island. So it is not a time to be complacent. And if we are complacent, that's when we put our communities at risk.
Do you have a follow-up, April?
Yeah, just so it's fair to say that despite not seeing a lot of new cases, or even only 1 or 2 new cases today, that the possibility of a second wave here on the island is possible, even though we haven't really seen anything like that from this pandemic.
It is absolutely possible. We know that there's people who work in other parts of the province and work in other provinces. We know that there's risk in the Lower Mainland in particular right now, but that it has moved around the province. And so we've seen it in the north. We've had challenges in the interior, and part of it is luck and part of it is us being careful, and we cannot stop being careful.
Next question is from Craig Takuchi, Georgia Strait.
Hi, Dr. Henry. Going back a bit to the closures of the nightclubs and banquet halls, I was just wondering if you could clarify something that you had mentioned early on regarding your approach, and that you want to avoid opening and closing things because it confuses people, and closing things down can potentially cause things to come up in underground ways. I was just wondering if those are still concerns of yours, or how those things might be addressed.
Yeah, it is challenges, and we did try and work with the industry, particularly around nightclubs and repositioning their business model to make it safer, but that proved an incredible challenge. We talked as well with the banquet hall associations about things that they were proposing as measures, and again, we continued to see people gathering in larger numbers and transmission events, and that's the thing that we look at. So that was what triggered us modifying the orders and ensuring that those places really cannot operate safely under those business models. And we're not alone in that. If we look around the world, we look across the country, those are situations where they're indoors, where they're crowded, where they're noisy, where people are eating and drinking, and those are perfect events and situations for this virus to be transmitted very quickly and rapidly between people. So right now it is not safe to have those types of environments open. If we want to, and we need to, for our community health, make sure we have other priorities functioning safely and well. And that includes schools, that includes people going back to work, and that includes the people who have been working in our essential services all along, making sure that we're not creating community conditions that make it more dangerous for them. And of course, we know that the importance of continuing to make sure our healthcare system is functioning and that our surgical restart program continues to move ahead.
Craig, do you have a follow-up?
Oh, yes, please. So just to restate my question, what I was asking about is, do you still have concerns about parties or events cropping up in underground ways, which you had raised concerns about before? And also, do you foresee at any point nightclubs and banquet halls reopening during the pandemic, such as if a vaccine is developed and so on?
Yeah, so in terms of things going underground, yes. And so if we look at, we put in a number of things around the same time. One, we started to enhance enforcement and to see if that made a difference around the nightclubs and banquet halls. And we also have some enforcement means now that we can use for other types of events. So we did see, and it's been publicized around some universities and parties happening in certain situations, but we had enforcement measures to take care of those. So these things all have been in parallel. And the enforcement is the last resort. So when we do see these things crop up, we do have a mechanism for addressing those. And for the most part, I think it's been relatively successful in the last few weeks. In terms of would they ever be open again, I think once we get to that phase where we have immunity through a vaccine or through effective treatments for large numbers of people, then yes, we would absolutely be looking at getting things back to the type of social interactions and events and whether it's sports or arts or nightclubs as soon as we possibly can.
Next question is from Camille Baines, Canadian Press.
Hi, Dr. Henry. Just going back to the question about film and TV, there's a rumor going on that there was an outbreak of COVID on a TV production. I'm wondering, you said you don't know of any, but how are film and TV productions conducting COVID-19 testing on their cast and crew? And are those test results being reported?
Yes, so there are testing, there's protocols that were agreed to, and I know WorkSafe has been involved with developing the protocols and ensuring that they're in place in all these workplaces. It is private testing, but absolutely any positive test is reportable to public health, and public health is working with all of the sets that we have. There's a number of them around the province right now to ensure that anybody who is positive is followed up on, is isolated appropriately, gets the health care they need, and that all contacts are identified. So the process is the same. It must be reported if there is a positive test, and we know that that is happening. The laboratory that is doing the testing automatically reports to public health.
Camille, do you have a follow-up?
Yes, I do. Can you talk about flu shots and how there might be a campaign or some more awareness created about getting them? And there are concerns that in other places, the flu shots, the vaccine, the campaign hasn't rolled out fast enough, and people are concerned about getting a test when they need it?
Getting the test or the flu shot?
The vaccine, sorry.
Yeah. Yes, we've been working on that for some time. The flu vaccine should be arriving in the aliquots that we have. We ordered it back in February. We did increase the amounts that we are receiving here in BC for this summer and for this fall, recognizing, as we did at the time, that there was an increased demand, and for a good reason, in the southern hemisphere during their winter. So we have plans for the flu shot to be available. We've been working with the BC CDC is leading this to make sure that we can get it through pharmacies, physician offices, public health clinics, and that we can do these types of clinics and immunization programs in a way that's modified and safe for COVID as well. So it does take some time and some planning and some differences from our usual season, in that we don't want mass clinics where there's lots of people there all at the one time. We want it to be spaced out and done on using appointments, done using different ways of making sure that we can get as many people immunized as possible. It is incredibly important this year, of all years, to make sure that we are doing what we all can to minimize influenza in the community, and that's by being immunized. That helps reduce the impact on our health services. We know every year, particularly seniors and very young children, end up in hospital with influenza, and that's the type of thing that we want to avoid. Particularly early on, we know that influenza and COVID can be a lot alike. It's very difficult to tell the difference, and sometimes we need to have a test to help us do that. So I encourage everybody to get their flu shot this year, and we'll be starting our campaign and rolling it out in the coming weeks. Usually it's about the middle of October to the end of October when we start doing the public campaigns and flu shot program. We also start, though, as soon as we can with the people who are most vulnerable in our long-term care homes, and we'll start seeing that happen in the coming weeks.
Marcella Bernardo, News 1130.
Hi there, Dr. Henry. Thank you for taking my question. I wanted to start off by asking you about the situation involving Vancouver Coastal Health and Fraser Health, and earlier today, you said that VCH is reporting all school exposures, but there are only 2 up right now, and a handful of schools in that health authority have sent out notifications beyond that. So it's very confusing for parents and teachers. Are the schools sending out notices they should not in Vancouver Coastal Health?
No, and I think what we need to realize is that schools send out notices for a variety of different concerns, but the public health notices that we are sending out around exposure events in schools are the same across the province, and the public health response is the same across the province. And where there's been a school exposure where public health is involved, they will be posted on all of our health authorities.
Do you have a follow-up, Marcella?
I do, regarding all the discussion about the second wave that the Prime Minister has put out there. How do you expect to try to bring everybody in line? Because you mentioned a few examples today about, the numbers are not where they need to be, but how do you foresee changing the measures that you have in place now to try to bring those numbers down if the people that you're asking to behave are not behaving, and we're still seeing instances where underground parties, things like that, are happening?
Yeah, I think that's our collective dilemma, really, Marcella. It's not the number in and of itself that's the issue. What is important for us is to say, can we manage this outbreak, this pandemic, make sure that we're doing everything we can to prevent transmission, making sure that we're not getting that rapidly increasing rates of people being infected, which means it's spreading widely very quickly. And we saw a little bit of that in Quebec in the last few days, where they've gone from very small numbers to quite large numbers. For the most part in BC, we've managed to flatten our curves and keep them in a manageable place. Obviously, I would prefer if we had far fewer people being infected, because we know every time somebody transmits it to somebody else, there's a risk that it's going to be somebody who gets very sick or dies from this. So we need to take those measures that will help prevent us from transmitting it to large numbers of people. Part of that is the orders we've put in place. Part of that is reinforcing every day to people that we have choices. We have choices about our own risk, the things that we do, who we interact with, and the risk that we bring home to our family, our households, the people we're closest to. And we need to remind ourselves of those. We had some time over the summer where we had very low rates, and we had people traveling in from other provinces. We moved around a lot to try and take advantage of the fact that we were able to do that. But we need to refocus now as we're going into the fall. And part of that is having more orders in place. Part of that is having some of the enforcement measures that we have available to us now to remind people who are not taking this as seriously as we would like. But the importance is not the numbers so much, but making sure that we can continue to safely have our schools open, because we know how important that is to our community wellness. Making sure that people can still go to work, that our essential workers are still protected, that our hospitals are still operating effectively. So it is trying to find that balance, and here in BC we've managed to do that, but we can't let our guard down now, particularly now. This is important for us to get through the next year, and we need to know that we need to find our ways to live with this virus and to protect as many people as we can, and to really focus on protecting those we know are going to suffer the most, and that's our elders and seniors.
Brishti Basu, Victoria Buzz.
Hi, Dr. Henry. Thanks for taking my question. I wanted to ask about the order that now allows nurses to prescribe alternatives to street drugs in BC. Is there any information on where and how the nurses can be trained or receive the expertise required to offer this kind of service?
Yeah, so we are working with the BC Centre on Substance Use, and they have nurses, physicians who have been doing this for some time, and they've developed training modules, and they've actually started engaging with nurses who are going to be involved in this, making sure that they have the training that they need, and it will roll out over the next number of weeks. The colleges are also looking at the terms and conditions that need to apply to make sure that it's all done safely within the parameters of the training and certification that's needed. So the BC Centre on Substance Use and the BC CDC are working on this even as we speak.
Do you have a follow-up, Brishti?
Yeah, so the order also states that there will be an expansion of the number of sites that that people can access prescription drugs at. Is there any timeline that we can expect for where these sites will open?
So there's a couple of things that are happening. It'll depend. So we know that there's different places right now that if we expand the number of people who are number of health professionals who are able to provide safer alternatives. So it could be an outreach team in the street that's there now. It could be a pharmacy. It could be in the emergency department. So there's many different settings around the province that we're looking at once we have the human resource ability to provide these services. The other piece that's really important is we're looking at what are the medications that are necessary to support people in these safer alternatives. And that is also ongoing work that we have been working on for some time. And again, it's all in play right now, and we'll be looking at that as we go into the next couple of weeks.
We have time for one more question today. For everyone listening, Dr. Henry will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Fran Yanora, the GOAT.
Thank you. Hello, Dr. Henry. Just my question is on the opioid situation in the north. The recent report indicates they have the highest rates, as you know, and I'm just wondering whether the provincial stats, which indicate 80% males, still 70%, 20 to 59, if that's that's actually also true in the North, and kind of what is it that you're seeing in the North?
Yeah, so we are still sadly seeing mostly younger people. We also know that First Nations and Indigenous people are overly represented in the overdose numbers that we've seen in the past few months as well. So there are several communities, as you're aware from the coroner's report yesterday, that have had tragically increases in numbers of people being affected across the North, and we've been working with Northern Health to look at what other supports can be put in place in those communities to reach people. And this is why things like my order to expand the number of providers who can support access to alternatives to the street drug supply are so important. It is such a challenge. There are so many. There's so many ways that there's so many things that need to be done, and there's no one thing that can make the difference. But we are tragically seeing the impacts of some of the measures we put in place for the pandemic rebounding and making a negative consequence of seeing increased numbers of people dying from overdoses, and that is something that is taking our attention for sure.
Fran, do you have a follow-up?
Yes, thank you. I saw an older. It's I think based on 2018 numbers released in 2019, and it indicated that in terms of the Indigenous, as you said, they're disproportionately affected, but also that women made up quite a bit higher percentage of overdoses compared to non-Indigenous, the gender ratios with non-Indigenous male and female. And I'm wondering if that's still the case, and kind of why, what's to be done about that.
Yeah, that is something, and I presented those numbers very recently with Dr. Shannon McDonald from the First Nations Health Authority. And this is something that we've seen from the very beginning, that Indigenous women, I believe it's 8 times more likely than non-Indigenous women to die from an overdose. And this is something that we're seeing across the province. It is many different factors that have led to that. We know that as Grand Chief Doug Kelly says, it's not a drug problem, it's a pain problem, and we have a pain problem in First Nations communities that is long-standing. It has to do with disruptions of communities. It has to do with intergenerational trauma, as we know. So those are all things that need to be addressed. But it is true that we continue to see First Nations women being overrepresented. And the impacts that has on communities, on their children, on the disruption of families is so immense. And it is a focus that we are having to see if we can put in place those supports to particularly support Indigenous women.
That's all the questions we have for today. Thank you for joining us.
Thank you.